Hi all, welcome to today's section. Today we will be discussing about a small topic that is importance of microbiology for nurses, but it is very important for first year nursing students. As an introduction, microbiology is the science that deals with microbes. Knowledge of microbes is used in healthcare for drug production, diagnosis, sterilization methods, and cleaning. So we'll go through importance of microbiology for nurses under various headings. The first importance is the knowledge of microbiology will help us to sterilize various surgical instruments. So being nurses, we will be dealing with various equipments and instruments as a part of giving care for our patients. So, various methods of sterilization or disinfection are being deployed by nurses to sterilize various surgical instruments. For example, autoclaving, dry heat sterilization we will be using, and the particular area where we are working, it has to be cleaned. So, disinfection process will be used. These are some of the sterilization procedure that happens in the ward. So, the knowledge of microbiology will be helping us in acquiring various practices to sterilize some of the equipments that we are using in the ward, to clean our ward, to prevent infection. So these include hot water, antiseptic solutions, etc. So to sterilize various surgical instruments, a basic knowledge of microbiology will be helping us a lot in our profession. So now we'll move to the next point. That is, it will empower nurses. We'll see how microbiology, the knowledge of microbiology empowers nurses. Being nurses, we know that we will be dealing with various patients with different diagnostics. For example, some patients will be with communicable disease. Some patients will be with after will be taking care of some patients after surgery. So, in all these care, we have to maintain strict infection control practices. So, the microbiology knowledge empowers nurses to deal with infected patients and their samples carefully and cautiously. So, this will help nurse to protect herself and also to protect the health of patient. So, by knowing the basic microbiological knowledge, we will be able to take care of the patient and to prevent patient from infection. And next is effectiveness of antibiotics. So, the knowledge of microbiology will be studying with various microorganisms, and we know that we will be giving medications for the patients. So all these medications, especially antibiotics will be giving, some other agents we will be giving because of the results of some of the these all infection occurs because of some of the bacteria, viral agents, and because of some of the fungal agents. So the basic knowledge about all these microbes will help each nurse to examine the effectiveness of antibiotic the patient is being administered. And hence, by finding the sensitivity of microorganisms towards drugs, it will help us to target the pathogen with appropriate drug, and it also aids the speedy recovery of the patient. For example, I can tell some of the infection will be caused because of Staphylococcus aureus or Streptococcus. Isn't it? So, for preventing or for reducing or for killing the particular microorganism, we will be administering some of the antibiotic, for example, penicillin, cephalosporin, etc. So once we have a basic knowledge about all these microorganisms, we will be able to identify the sensitivity of microorganism towards the drug that we are administering for the patient. And by identifying it, we can reduce the some of the complication for the patient, and it will definitely help us in the speedy recovery of the patient whom we are taking care. And it will also help us in identifying some of the blood groups, because we can identify the blood groups of the patient by some of the immune reactions that we see in the slide. And it is also the knowledge of microbiology is also important for us in identifying, in understanding various diagnoses. For example, Mandos text for diagnosing tuberculosis. So once we have a knowledge about Mycobacterium tuberculosis that causes tuberculosis, we will be able to identify some of the diagnostic tests. We'll be doing Mandos test for the patient for identifying the changes that happens in the skin. Okay, so by having a thorough knowledge about the microbes that is causing tuberculosis, we will be able to understand the condition of the patient, and we will be able to diagnose the condition of the patient as tuberculosis or some other disease conditions. And the very important relevance of microbiology for nurses is it will help us to understand the principles of community hygiene and prevention of disease. Okay. The study of microbiology will help nurses in understanding the principles of hospital and community hygiene maintenance. Okay. So we will be studying about various pathogens, the characteristic features of various pathogens, and we are the one who is maintaining who is taking care of various equipments. We will be taking various equipments and some of the personal protective equipments like gloves. Sometimes we'll take some of the gowns for taking care of patients. So everything has to be maintained, everything has to be discarded properly. That is biomedical waste management. So by having all knowledge about all these microbes and biomedical waste management and taking care of, by knowing about some of the infection control practice, it will be helping us to maintain or to contribute in reduction of mortality and morbidity and duration of hospital stay in patients. So microbiology is very important for us because the knowledge of microbiology will be helping us a lot in taking care of our patients and to maintain the ethics in our profession. That is, being nurses, we know that we are the one who is having more contact with the patient. So we'll be taking care of the patient. We will be administering medications. We will be doing some of the diagnostic procedures for the patient. Okay, so always there is a chance of spreading the infection from our side, and also there is a chance of spreading the infection from the patient, from the surrounding area to others, even for our healthcare workers also. So by understanding microbiology, we'll be able to control infection, and we will be able to reduce the spread of infection from person to person, and it will help us a nurse to understand the principles of hospital and community hygiene maintenance and prevention of disease, and to contribute in reduction of mortality and morbidity, and it will help the patient to reduce the duration of hospital stay. So hope you have understood these concepts, and it is very important in first year microbiology for nurses. So thank you for listening. Hope you have understood.